So we have Nancy here with us, who has a really interesting story to talk about the shockwave machines today. So Nancy, if you don't mind starting with a little bit history-wise, because we know you came in with a frozen shoulder on that right side about 2 years ago. We did some shockwave in PT. Fill us in a little bit about that background.
Okay. Yeah, I was in a lot of pain when I first came here, and I couldn't really get my arm beyond here, and it was had been that way for a while. I probably waited a little too long, but then I started seeing Dr. Holly when I came here, and we did PT and we did shockwave therapy. And I think the shockwave therapy was new at the time to this office, um, and they might not even have had it when I first started my PT. But when we added it, I felt like the healing improved, and I started feeling better quicker. And so eventually, after many months of working on it and coming here, it healed, and my right shoulder feels great. Fast forward a while, my left shoulder is having problems. And when I came back this time, Holly told me that they had a new machine here, an EMTT, which works a little bit differently from the shock wave, more like, if I remember correctly, at the cellular level. And and it's pain-free when you use this. It just sits on my shoulder and sparks a little electrical shock through the injured area, and we use that along with PT and shockwave at the same time. So I do think that my left shoulder is healing faster because I'm using both of these therapies at the same time. Um, and that's my story. I think it's been great having this EMTT available, and I'm looking forward to healing much faster than with my first shoulder.
I love hearing that, Nancy. And then, if you don't mind, how quickly did you notice the difference? Because we talked about this a
Oh,
little bit ago.
I
How many
think
sessions?
I forget if it was the first session or the first two sessions, but it was very quickly that I noticed a difference.
Awesome. And then, what would you say to somebody who's maybe not familiar with the EMTT or the shockwave machine, or maybe doesn't really feel like it's as good as it sounds?
Well, I'd say come in and give it a try, and find out more about it from the people who know more about it than I do. And I also think that, once you try it, you'll be convinced. And it's also a type of therapy that's not available at other PT offices. So I think that makes a difference.